Okay, let's start our revision section. So read the question, try to answer. It is same as a dumping syndrome question again. The nurse is monitoring client for the early signs and symptom of dumping syndrome. Which of the following indicate this occurrence? Okay. Dumping syndrome, signs and symptom they are asking. What is the indication? Which signs and symptom will be early occur? If you just remember the dumping syndrome, signs and symptom, you can easily answer. Okay, the patient will be palpitated. I will revise the dumping syndrome. So there is a part of the stomach will be removed. So whatever food you are just eating, it will just coming to the duodenum very fastly because stomach part is already removed. Okay, that is cause there is a massive fluid shift that will only cause the dumping syndrome. Got the point? This is the pathophysiology of the dumping syndrome. So here symptom, what will be the, because sudden fluid shift, the food is coming like that, there will be the patient having heart rate increase. So palpitation will be that. Okay, so patient will be having palpitated, like sweating, and the patient will be very anxiety and like a flushing symptom. You just get some allergy, what they will be? They will be like pallor and the flushing movement will be there. There's a palpitation will be there. Then the later there is a chance of abdominal cramping. Okay, so first is the, what is the sign? So now find out which will be the answer. Okay, so from down to up, we will come abdominal cramping and pain. So I have told you this come from last symptom. So it is, they're just asking the early signs and symptoms. So that's why each question from you have to take the answer from the question. Question you have to read very carefully. Early signs and symptoms they have asked. They didn't ask you the later. So later is abdominal cramping. So we should be avoid that question. Double vision and chest pain. Nothing to connect with that. So double vision chest pain won't come. And the bradycardia and indigestion, I have told you palpation. Palpitation will be there for the patient. That means there is heart rate increase, not bradycardia. Bradycardia means down the heart rate is decreased. So it won't come. Next one, sweating and pallor. So when the flushing symptom like the patient will be very fleshy, anxiety, pallor will be there, sweating will be there. So you can select the answer 1, sweating and pallor. Got the point? So like this way only you have to be answer the questions. Okay. So I will be just, we will move on to the second part of the vision. Okay, so in that I'm going to show you the answer also because these questions are not that we have covered, but still we are going to revise because there is so many questions. Okay, in between we are going to revise. So take the key point. That is a very important thing. Okay, so if I now revise, then you forgot, nothing will be work out. Okay, so we have to be write the key points. So here the question, see, the nurse is teaching a client diagnosed with the Raynaud phenomena. Okay, Raynaud phenomenon already we have seen in the cardiovascular system. Okay, about how to avoid recurrent episode with the instruction should be included. So here the answer is Raynaud syndrome because of cold. So avoid cold temperatures the answer. Okay. So this is answer. We'll move on. Next question. So which nursing action is essential prior to the initiation of new prescription for the 500 ml fat emulsion to infuse at 50 ml per hour? So we are going to see, just infuse the fat emulsion. You have to remember first thing you have to ask the patient, have you have the allergy of the egg? Okay, because that also having the fat emulsion. So lipids are there in the egg. So we have to assess the allergy of the egg. Then only have to start this initiation of the fat emulsion feeding. Okay, so remember the key point, fat emulsion, you have to check for the egg allergy. Okay, like that you just write it down. Next question. I think this we have seen already, TPN. Have you remembered? TPN, it's a parental nutrition, total parental nutrition. So the nurse is making initial round at the beginning of the shift and noted that the parental nutrition bag of an assigned client is empty. Which solution readily available on the nursing unit should the nurse hang until the another parenteral nutrition solution mixed and delivered to the nursing unit. So before the next bag, you should not be stopped. You should not be without anything because patient go to the hypoglycemic attack. So what you have to do, 10% dextrose in water we will give for the patient until the next bag comes. Got the point? Okay, next one. Patient receive a transfusion of packed red cells. Okay, this is the blood transfusion question. Client blood pressure 90/50 from the baseline of 125/78. Okay, here note down 90/50. It's normal for some of the patient, but still they have already mentioned baseline is 125/78. From that, it is decreased 90/50. That means there is a patient will be BP low, patient low BP. Okay, the client temperature is 100.8. There is temperature also, fever. The nurse determined that client may be experienced which complication of blood transfusion. So we have the patient have fever, then the BP also down. So there is a chance of septicemia. So septic shock, circulatory overload until BP will be increased. Okay. So that will be, you have to remember the answer is septicemia. Okay. So we'll move on. Okay, next question. A client receiving parenteral nutrition, the home setting has a weight gain is 5 IP in 1 week. 1 week they have just received in home setting. So 1 week they are just increase the weight. The nurse should next assess the client for the presence of which condition? It is the condition that there is fluid overload in your body. Okay, because the weight increase, it is equal to the fluid increase. Okay, so there is a chance of the lung having fluid in the lungs. Okay, so you have to auscultate the lung for the crackle sound. Got the point for the total parenteral nutrition. Okay, crackles on the auscultation of the lungs, it is indicate there is a lung swelling. Lung will be filled with the fluid. Got the point? Hope you understand. Any doubt, you can unmute and ask me. Okay. Next one. Client receiving total parenteral nutrition exhibits symptom of the congestive heart failure. Okay. And pulmonary edema. Which complication of TPN is client most likely experience? There is congestive heart failure and edema, pulmonary edema. Because of why? The patient having fluid overload. There is so much TPN is infused. So this will be stagnated in the lungs and the as well as that is pulmonary edema. As well as the heart, it is congestive heart failure. Okay, got the point? So fluid volume overload. Got the point? So if it is decreased BP, temperature increase, that is septicemia. Next one, see here. From this question, you will be just getting this answer also. Okay. So using Maslow hierarchy of the needs, a nurse assign the highest priority to which client needs. Okay, Maslow hierarchy. Need a nurse assign the highest priority which client needs. First priority, what is that? This is the Maslow hierarchy. See that? From this question, we are going to see the Maslow hierarchy. So we have 5 points in the Maslow hierarchy. So from down to the need from the human being, from down to up, it's like a triangle. Okay. So first is not self-actualization. That will become under 5th point. So from down to up. So remember, first one is physiological need is priority. This is important for the question point of view as well as the question answer section also. When you are just correcting, just looking for the answer, you have to prioritize this way. Okay. So first important, you have to give for the physiological needs. Then only there is a safety. Then only love and belonging, self-esteem, self-actualization. Okay. So it will be like that hierarchy. So remember, first one, physiological needs. Okay. So here the question, it is highest priority. What will be the highest? It is the first physiological needs from down to up only, right? So what is the physiology here? It is elimination. See, oxygen, nutrition, fluid, body temperature, elimination, shelter, sex. These are all the physiological needs. The second one, safety and security. There is a physical and psychological safety. And third one, love and belonging needs will be there. Then the self-esteem. These three is very important. First, second, third. Okay, physiological and the physical safety then the love and belonging, and then it will come self-esteem, self-actualization under. Okay. So remember that these things, so love and belonging under the family setup, it will come. Okay. So here the answer is elimination. Got the point? We will move on. So here, what is the lab value you can expect in the diabetic ketoacidosis they have asked? Okay, what will be the lab value? Ketone will be increased, potassium will be increased for the diabetic ketoacidosis patient. Okay, we will see in the endocrine system. I will be taking. So just remember diabetic ketoacidosis. Keto means ketone increase, and there is a potassium also will be increased. So what is the normal range? Potassium 3.5 to 5. So what is the increase range here? Potassium 7.5. Okay, easily you can answer this type of question. Okay, so we will just revise the important points. Antidote of magnesium sulfate. It is calcium gluconate. Okay, antidote of magnesium sulfate is calcium gluconate. Don't forget. Okay, so when the patient having magnesium sulfate toxicity, we will give calcium gluconate. What is the morphine antidote? It is naloxone. Any opioids antidote? It is naloxone or Narcan, otherwise called Narcan. Okay, hydrocephalus sign. Okay, we will see in the pediatric, but these are the previous question paper. I have taken only the key points. Okay, so hydrocephalus, what you have to remember, bulging anterior fontanelles, and HCC, head circumference will be increased only for infant. Okay, not for the older child. For the hydrocephalus, there is an increased fluid in the CSF collection in the brain. So brain will be bulged. So in that, there is a bulging of anterior fontanelles will be seen. Increased head circumference will be seen. Okay. Digoxin should not be given the heart rate less than what? 60 beats per minute. We should not give the digoxin. Okay. Why? Because digoxin have the already having the complication, already having the side effect of decreasing heart rate. So already decreasing heart rate, you will give what will be there. There is a bradycardia patient will be go to the 40, 30 heart rate. It will be very bad condition, cardiac arrest. Okay. So OPV, oral polio vaccine, and mixed of the live attenuative polio vaccines. Okay. So OPV will be the oral polio vaccine and live attenuative vaccine. This is the OPV. Polio vaccine is the live attenuative vaccine. So mainly HIV infection patient and all, we won't give the live attenuated vaccine. Okay. So that will be the example OPV. Remember. Okay. Postpartum perineal assessment. What will be the scale? REDA scale. Postpartum perineal assessment. It is a REDA scale. So what you have to remember, REDA, R for redness, E for edema, E for ecchymosis, D for any discharge, A for approximation. So in the except question, they have just asked. So postpartum perineal assessment, you have to remember REDA scale. Okay. Each will be REDA, you have to remember redness, edema, ecchymosis, and the discharge or approximation. Okay. So we'll move on. Okay. When taking a BP, selected the appropriate cuff size. Okay. Here the question, sometimes they will ask you, why the false reading coming for the patient? So how to prevent it for the BP? Okay. So BP, if we have to, the criteria is to appropriate cuff size we have to select. Okay. If it is cuff is too small, what will be happen? False high reading will be shown. Cuff is too small, that is high reading. Cuff is too large, that is a false low one. Okay, got the point? So BP, when you are taking the BP, you have to remember cuff size should be appropriate. Otherwise, it is too small, it is increase the reading will come. Too large, it will be low reading will come. Okay, it is about the BP cuff. So next one, complication of diabetic mother. What is the complication? We have already, there will be the, it is covering in the OBG system. Okay. So complication of diabetic mother is hypoglycemia and macrosomia. Remember, hypoglycemia, macrosomia. Okay. OPV vaccine is, we have already seen, that is a repeated question. So patient with the BP 230, 180, consider as hypertensive crisis. Remember, 230, it is about 200. Okay. And 180. This is a diastolic. So consider as it is hypertensive crisis. Okay, next one. Isoniazid. See, TP side effect. Isoniazid patient, so tuberculosis patient, we will give main drug is isoniazid. So what is the side effect it will cause? Numbness, hepatitis symptoms, stomach upset, rashes. Okay, so the hepatitis symptom only stomach upset and the rashes, and there will be the numbness because the isoniazid patient have peripheral neuropathy. If they ask you directly, only also you have to answer peripheral neuropathy. That's why numbness coming. Okay, what is the thing you will give? You will just give the isoniazid patient vitamin B6 supplement. Okay, okay, so that is a pyridoxine. That is the tablet vitamin B6 we will give for the isoniazid patient. So next one, neck rigidity. Nerve stiffness, signs of meningitis. Okay, neck rigidity means it is a nerve will be stiff. Okay, neck will be stiff and there is a signs of meningitis. Okay, now cause the tooth pain. Which nerve will cause the tooth pain? Okay, that is the question here. I didn't give the answer. So which nerve will be caused? The patient will be having the pain in here. There is a trigeminal nerve. So trigeminal neuralgia, there is a tooth pain. Got the point? So fifth cranial nerve only trigeminal neuralgia. So trigeminal nerves, it will cause the tooth pain. So next one, hypoglossal nerve. It is a 12th cranial nerve. It will be used for the invertase of the tongue muscle movement. Hypoglossal nerve. 12th cranial nerve. Remember the point. These are all from your previous question paper. So only I have given you key point. Hypoglossal nerve. It is a 12th cranial nerve. It is causing the innervates tongue muscles. Okay. MI patient, what is the ECG changes? ST elevation. Okay. Ischemia patient, ST depression. Angina pectoris patient, ST depression. Only MI patient, ST elevation. Okay. Common cause of death in school age. Okay. What is the common cause for the death in school age? It is because of accident. Okay. So serotonin. Serotonin decrease, it is mean Alzheimer disease. Okay, serotonin decrease in the Alzheimer disease. Dopamine increase in schizophrenia. Don't forget. Serotonin decrease in Alzheimer disease. Dopamine we will be seeing in the mental health, but still just remember these are the previous questions. Okay, dopamine will be increased for the schizophrenia disease condition. These are the neurotransmitters. Okay, here the next question. A nurse working in the medical, these are the common questions, okay? Nurse working in the medical unit is going out, okay? That means going to remove with the droplet precaution measure in the place. The following personal protective equipment, eyewear, okay? What is the correct sequence for the putting the equipment off? What is mean by putting the equipment off? That means removing, okay? You are going to doffing the when we just COVID time, we know donning, doffing. What is donning? It is wearing the PPE, personal protective equipment. What is doffing? It is just removing the PPE. So that only we are just, they have given putting the equipment off. We're going to remove. So first, which one you will be remove? That is the question here. So you'll just remove the face mask first. No, just read the question. You will be able to answer very clearly. Okay, gown you will remove first. When you remove the gloves, you have a gown, you are the gloves. It's contaminated. You will touch that with the gown? No. You will touch the gloves with the mask? No. So what will be the first removal part? It is gloves because the hand is needed for remove everything. So before that, you have to remove the glove. Then you go from the up. Okay, eyewear we will remove. Then the gown, the last only there is a face mask. Okay, so D is the answer. Got the point? Easily you can be when you just remember you are in the medical setup. So how you will remove it will be easy. Okay, so D is the answer. We'll move on to the next one. So same thing in the medical unit preparing droplet precautions. So here the question: what is the correct sequence for putting the equipment on? Means there is a donning. Okay, donning means putting the equipment. So which one you will put first? If you just put the gloves first, what will be happen? What will be happen? After gloves putting, you are putting everything. This is the contaminator one. Okay, so you cannot put the gloves first. Okay, always remember whatever putting first, okay, it will be last removed. Okay, that means what is the removed first? Gloves. So that will be, you have to remember like that. So whatever you are putting the last, it will be removed first. So gloves you will put the last. So you will be remove first. So gloves will be come under last section. So what will be put first? It is gown. You have to wear the gown. Okay. Then only face mask. Then the eyewear. Then you will put the gloves. So B is the answer. Got the point? B is the answer. Okay. Hope you understand. Okay. Here the next question. Okay. Somebody is answering. Okay. Very good. You find an adult who is unresponsive and not breathing. The scene is safe. Okay, just remember this is a condition of the emergency situation. Patient is unresponsive, not breathing. The scene is safe. What is your next step? They have asked. We mostly answer start CPR because the scene is safe, so we can start the CPR. Who will check the pulse? They will miss. You will see the answers most properly. The true answer will be correct. So if you're not see the proper answer, you just not read the answers properly, you will be end up with the wrong question, wrong answer. Okay, so you have to be very careful. They just check that. That's why I'm telling always take the answer from the question. Question when you read clearly only you will get. Unresponsive, not breathing, scene is safe. You have to check the pulse, then only you have to start the CPR. Okay. So these and all, we didn't revise the CPR topic. That's why I given the all the questions. Okay, we have only less timing. In the 30 days, we will be covering all the topics. Okay, we have few more administrations and every topics are there. So we'll move on. A male client is admitted to the. Just remember all the important point, key points. Write it down because same question in the different situation they will ask you. Okay, so admitted to the hospital with a blunt chest trauma after the motor vehicle accident. Okay, the nurse first priority for this client would be what? There is a airway because always ABC only airway, breathing, circulation. Okay, that is a priority. So already they are doing chest trauma. So always it is a airway. So assess the client airway. That is the first priority. Okay, we'll move on to the next one. Here and all I have given you the answer because these and all the new topics. Okay, the nurse caring for the client with the diagnosis of cancer who is immunosuppressed. Okay, the nurse would consider there is a implanting neutropenic precaution. The client blood cell count was which of the following? Okay, neutropenic precaution means there is low WBC, low neutrophils patient, immunocompromised patient. We will give the neutropenic precaution. So what is the blood cell count will be reached? It will be the normal for 4,000 to 11,000 WBC. So now here see 2,000 only is that. So that means the patient will be very low immunity, immunocompromised patient. Okay, so you have to know the WBC normal value, then only you can answer. Okay, normal is 4,000 to 11,000. So answer is here 2,000 cells. Okay, A is the answer. Next one. A female patient is diagnosed with a deep vein thrombosis. Which nursing diagnosis should receive the highest priority in time? Okay, female patient, deep vein thrombosis. So here, see import gas exchange related to increased blood flow. There is a diagnosis, sister. It is wrong. Increased blood flow will cause the import gas exchange. No, right? And fluid volume excess related to peripheral vascular disease. Okay, peripheral vascular disease. Because of that, fluid volume excessive will come. So some question, if you read itself, you will understand. That will be no connection. This for injury related to edema, it is correct only. The diagnosis wise, but it is not related to deep vein thrombosis. So what will be the diagnosis? Altered peripheral disease. Okay, sorry, tissue perfusion related to venous congestion. Deep vein thrombosis, there is a block. Okay, block means the thrombus will be, clot will be obstructed. So the patient will be having congestion in the venous system. So there is a peripheral tissue perfusion will be altered. So D is the answer. Okay, got the point? Some of the time they will ask you diagnostic question directly. So you have to answer likewise. Next question. A community health nurse was evaluating DOTS program. I think we have already seen DOTS in the respiratory system. What is DOTS? It is a direct observation treatment short course. Okay, direct observation treatment short course. That is S is for the short course. So it is for specifically pulmonary tuberculosis patient. What is the aim of DOTS? Why we have just doing the community health program DOTS? To prevent the antibiotic resistance. So because we are giving 6 or 7 tablets, the patient is not taking, it will cause resistance. That's why prevent the antibiotic resistance. We are just going and each home and giving the tablet in front of the healthcare personnel. The patient has to take the tuberculosis tablet. Got the point? So this to prevent the antibiotic resistance. Got the points? Okay. We'll move on. Okay. These about the today topic. So next class, we will see the most revision points. Okay. So each revision is very important. When you are not studied the previous videos only, you can able to revise very quickly. Okay. Try to be attend every video and take out the key points. Okay. When you take the key points only, it will be very useful when you are revising. Okay. So we will see in the next revision class.